Hello, Clinic Review family. I've got a special treat for you today. We're doing a prioritization video, something you absolutely have to know for the NCLEX. So let's go ahead and get started. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. And today we're going to be doing one of my favorite prioritization strategies. It's what I call the unexpected finding. You know that this YouTube channel is a part of the greater Clinic Review organization. And the Clinic Review organization offers NCLEX reviews. They're phenomenal, y'all. Mark Klimek does those. He is the most phenomenal teacher. He's taught me everything I know about NCLEX. So I recommend those. We also have monthly packages for small group tutoring and a streaming service. So you can go to clinicreviews.com for that. Today, I'm going to be talking about one of my favorite prioritization strategies. This prioritization strategy, you use it very consistently. In many ways, the NCLEX is highly predictable. So if you don't know this, what the National Council of State Boards of Nursing does is they bring in people who've applied to be test writers. They've applied, they've accepted them. They bring them in, they teach them how to write questions. Recently, I received an email asking me to apply. This was just last week, I think. So I went in, I'm like, oh, I'll apply to be on this. And I went through it and it said, if you got through the whole application, got to the end, said, if you're accepted for this, you have to agree not to do any NCLEX preparation with anybody for 3 years. Like, well, I can't agree to do that, y'all. I got a YouTube channel. I can't do that. So I had to not submit my application. Anyway, the point I'm trying to make is that they bring people in and they teach them how to write questions. And then they write questions in that way. Okay. And the reason they teach them how to write questions is because they have to be written in a specific way so that the answers are objectively correct. Okay. They have to be objectively correct, which means there has to be a rule that you follow. Now, sometimes it's just a fact, but you might be surprised how many nursing professors and nursing experts disagree on what the highest priority is unless there's a rule that they're supposed to follow. And so what we do in Clinic Reviews is we teach you that rule. Now, what I'm doing with this prioritization strategy is I'm teaching you this one. It's not as a part of the Clinic Review prep course. And so I can teach it to you because I'm not giving away, insider information on this. So what I'm doing is I'm going to teach you this one. I call it unexpected finding. This is when you have a question. It's a very short question stem, very, very short. They give you very little information about the patient. They tell you that they have a client, you have their diagnosis, their medical diagnosis, and then they may tell you something else about them, like a medication that they're taking, or they're wearing oxygen, or they have a chest tube. But what they don't do is they don't give you any assessment data. Okay, so it's a very short question. Here's the client, here's their medical diagnosis. And then they say, what are you most concerned about? And y'all, you're always most concerned about the unexpected finding. So in other words, all the assessment data is in the answers, and 3 of those are going to be expected and consistent with the medical diagnosis. That's why they have to give you a medical diagnosis so you know what to look for. So they give you that and you go, well, A, B, and D are all expected. C is totally not expected. So that's the one I'm most concerned about. That's the one I'm going to report to the healthcare provider. That's the one that I'm going to intervene immediately, or that's the one I'm going to report to the next shift. All of those things mean the same thing. You're going to report the unexpected finding to the next shift. You're going to report the unexpected finding to the healthcare provider. You're going to be most concerned about the unexpected finding. You're going to be intervening immediately with the unexpected finding. And so you have to understand how these questions are written so that you know the rule to use when you're answering them. And if you don't use this rule while you're answering your practice questions, you're not going to use it during the NCLEX. So you have to use it even when you're practicing with your database. Whatever database you're using of questions, you have to use this rule even then. And I'll tell you, identifying the unexpected finding is just a really good strategy because they want to know if a nurse can do that, right? That's one of the clinical reasoning strategies that they're testing to see if you have. All right, let's go ahead and get started. A client with COPD is receiving oxygen therapy at 2 liters via nasal cannula. Which assessment finding is most concerning? The client has a productive cough with thick white sputum. Is that expected with COPD? Maybe. Y'all, I want you to know I put question marks next to things sometimes. I go, maybe it is. So I'm putting a question mark next to it. Could be. Client has a respiratory rate of 28. Maybe. That's pretty high, but it could be with COPD. So I'm going to put a question mark next to it. The client has clubbing of the fingernails. All right, that one I'm really confident is consistent with a diagnosis of COPD. Clubbing of the fingernails is where the fingernail flattens out, and it happens with chronic hypoxia. And so I can, especially if they're wearing oxygen, I can see that they could be chronically hypoxic. So C is definitely expected. So I'm not going to pick that one. The client becomes drowsy and difficult to arouse. Okay. That one I know is unexpected. I know D is unexpected. And I am not going to choose the answer I'm not sure about over the answer I am sure about. I may not be sure about A and B. Remember, I put question marks next to them, but I know for sure that D is unexpected. If you're like, why would that be unexpected? Well, first of all, it's unexpected pretty much with anybody, unless I'm giving them a med to make them drowsy. But it's probably a buildup of CO2. That's my concerns. They're becoming hypercapnic. So that's why that's unexpected. A client with heart failure is being treated with diuretics and ACE inhibitors, which assessment finding requires immediate intervention. So I do have to keep in mind they're taking diuretics and ACE inhibitors. A client with heart failure is being treated with diuretics and ACE inhibitors. Okay. So I'll keep that in mind. A client reports a dry cough. Well, if you don't know this, a dry cough is the most common side effect of ACE inhibitors. So that's expected. It's irritating. They may not want to take the med because of it, but it's still expected with an ACE inhibitor. The client has bilateral crackles in the lung bases. That's pretty expected with heart failure, y'all. Not everybody with heart failure may have it. And you might go, well, they're taking a diuretic. They shouldn't have bilateral crackles in the bases. I mean, their heart failure, that's kind of consistent with the diagnosis of heart failure. So I'm keeping it, I'm going to say it's expected unless nothing else is unexpected. Client's potassium level is 5.5. Well, that's high. 3.5 to 5 is normal. So that's definitely unexpected. And there's nothing about the meds or about the diagnosis that would make me think it should be high. So that's unexpected. Client is pitting edema in the lower extremities. Very consistent with the heart failure diagnosis. So I'm going to have to pick C. That's unexpected. And y'all don't say, but if they're pitting edema and bilateral crackles, that means the diuretics aren't working. Y'all, you're saying if, okay, instead of just objectively looking at what we have a client who's being treated with 2 of the typical medications that are used for heart failure, and B and D are consistent with typical symptoms of a patient with heart failure. They didn't tell me that their O2 sat is low. They didn't tell me that their heart rate is up. They didn't tell me their blood pressure was low. They didn't tell me any of that. They just said they gave me 2 physical assessment findings that are actually consistent with heart failure. So I have to call those expected. A client with pneumonia is receiving IV antibiotics, which assessment finding is most concerning. All right. The client has a temperature of 100.8, which is a little high, but that's sort of consistent with pneumonia. A client reports a rash on the chest and arms. That's not consistent with pneumonia. That's not consistent with antibiotics. Client reports shortness of breath during activity. Again, that's expected with pneumonia. The client's white blood cell count is elevated. Well, that's consistent with bacterial pneumonia. Probably would even be up with viral pneumonia. I don't know if it'd be up as much, but it would still be up with a viral pneumonia. So that's consistent. Now, B is the only unexpected finding. And y'all, I'm glad this question is here because I can almost guarantee you're going to get a question on the NCLEX that asks if you can recognize what an allergic reaction looks like. And you don't want to miss that question. And here's one way they can ask you that. So you need to be prepared for that allergic reaction question. Okay, hives, wheezing, rash, those kinds of things, allergic reaction. And those are always a serious, serious concern. So you need to make sure that you recognize those when you see them. Client with liver cirrhosis is being managed conservatively, which assessment finding requires immediate intervention. So liver cirrhosis. The client has jaundice and reports itching. Well, that's actually pretty consistent with a cirrhosis diagnosis. Client is disoriented and has asterixis. Asterixis is hand flapping. That is actually consistent with hepatic encephalopathy, which is confusion. It's a buildup of ammonia that occurs with liver cirrhosis. And so B is unexpected. And it's not expected, y'all, because I don't expect them to develop hepatic encephalopathy. That's a complication. It's not an expected finding. It's a complication. So yeah, B is a problem. The client has abdominal distension due to ascites. Again, that's an expected finding with liver cirrhosis. The client has peripheral edema, expected finding with liver cirrhosis. Both the ascites and the peripheral edema is due to the loss of plasma proteins. that is seen with cirrhosis, because the liver is responsible for making sure we have enough plasma proteins. And when we lose plasma proteins, then the water can third space, including into the abdominal cavity and into the third spacing into the tissues in the lower extremities. So the only one that's unexpected is B. A nurse admits a client with hyperthyroidism, which assessment data should be reported to the next shift. Hyperthyroidism, think of it as hypermetabolism. Hypermetabolism is like you're burning hot, burning off all the calories that you take in. So it's like a fast running engine. So think of the car being in neutral and you're revving the engine and you put your hand on it and it kind of feels like it's trembling under your hand and it gets warm really fast, right? And it's using up a lot of gas. You're not going anywhere, but it's using up a lot of gas. So that's hypermetabolism. It's a hyper fast running engine. The client reports a sore throat and fever. Well, actually, I expect the body temperature to go up, but I don't expect a sore throat. That's not consistent with hyperthyroidism. Client experiences weight loss despite increased appetite. Very classic hyperthyroidism. Okay, you're a fast running engine. You're using a lot of calories, but you're still losing weight. The client has tremors and heat intolerance. Tremors, think of that fast running engine. You can feel it tremoring under your hand. And heat intolerance, because you're hot, your body temperature is going up. And so you feel hot all the time. And you're like, oh, I don't want it to be, I need it colder in here. The client has a heart rate of 100 beats per minute. Actually, I'd be okay with it even if it was 110 because it's a fast running engine. So the heart rate is at the higher end for sure. So the only unexpected finding here is A, sore throat and fever. A client with schizophrenia is receiving antipsychotic medication, which assessment finding requires immediate intervention. All right, schizophrenia, psych diagnosis, unclear thinking, fast talking, delusional, maybe hallucinating, that kind of thing, and then antipsychotic medication. All right, client reports dry mouth and blurred vision. That's actually a side effect. That's an anticholinergic side effect associated with any psychotropic drug. Psychotropic drug is a psych drug, whether it's an antidepressant or an antipsychotic. Anticholinergic side effects are expected with those meds, so that's expected. Client exhibits muscle rigidity and high fever. That is not associated with either schizophrenia or antipsychotic medication. In fact, antipsychotics can cause NMS, neuroleptic malignant syndrome. It's a very, very high temperature. And that's caused by antipsychotics, usually in older adults, and because they're not metabolizing it as well. Muscle rigidity is also a symptom of neuroleptic malignant syndrome. So that's a problem. B is a problem. The client has gained 5 pounds in 1 week. Weight gain, one of the most common side effects of any psych drug, experiences restlessness and pacing. That's actually consistent with the schizophrenia. So the only one that's unexpected here is B. So I'm very concerned about that. I have to do something about that immediately. In fact, you have to stop the medication with that. Client with a peptic ulcer is on proton pump inhibitor therapy like Protonix, PPI. Which assessment findings should be reported to the healthcare provider? So PPI is expected treatment for peptic ulcer. The client reports black tarry stools. All right. That could indicate the ulcer is bleeding, which could be expected. It's not that unexpected for a peptic ulcer to bleed, but we'll keep a question mark next to it. The client has occasional nausea after eating. That's not surprising with a peptic ulcer. The patient reports epigastric discomfort relieved by antacids, very classic peptic ulcer. The client tests positive for Helicobacter pylori. Okay, Helicobacter pylori is inconsistent with the treatment that they're getting. If he had a peptic ulcer with H. pylori and they knew about it, he'd be on an antibiotic because this is a bacteria that causes a peptic ulcer, and you have to be on an antibiotic for 7 days for that. It's pretty much gets rid of it. So I have to notify the healthcare provider about that. And I put a question mark next to A, but A is fine. I mean, if their ulcer is bleeding and they have some black tarry stools, that's not that surprising. So there's nothing about D that is expected. Remember, I choose the answer I know is unexpected rather than the one I'm not sure about. Okay, so I have to do that. Client with bipolar disorder is in the manic phase. So that's that high phase, right? Active, delusional, hallucinating often, very irrational thinking, magical thinking, is prescribed a mood stabilizer. A mood stabilizer, example of a mood stabilizer is tricyclic antidepressants, is example of a mood stabilizer. Which assessment data should be reported to the healthcare provider? A client sleeps only 2 hours per night, but feels rested. That's very classic manic phase. They don't sleep much, but they have lots of energy. Talks rapidly and interrupts others. Very classic mania. The client expresses grandiose thoughts about abilities. Very classic mania. Magical thinking, grandiose thoughts. That's sort of magical thinking. Like I can jump off a building and survive. That's very grandiose thinking. Client attempts to give away personal belongings. So A, B, and C are classic mania. D is nothing to do with mania. There's nothing about that would make you think that was consistent with a mania diagnosis. And I don't know if this guy is suicidal, but at least on for testing purposes, giving away personal belongings is sort of classic suicidal ideation. So I don't know what's going on, but that's concerning to me that they're giving away their personal belongings. Client with major depressive disorder is receiving antidepressant therapy. Which assessment finding is most concerning? The client reports a lack of appetite. That's a pretty common side effect of depression. The client complains of constipation. Constipation is an anticholinergic side effect. So bladder retention, blurred vision, constipation, and dry mouth are your classic anticholinergic side effects. So B is consistent with the antidepressant therapy. Client shows improved energy levels, but remains withdrawn. So that can happen when you start on antidepressant therapy. The concern is that when your energy levels improve before your mood improves, is there at risk for suicide? So I'm going to leave a question mark next to C. The client experiences occasional headaches. So headache is one of the most common side effects. Nausea and headache are the two most common side effects of just about any oral medication. Any oral medication can cause headaches and nausea. So I'm really not concerned about D. So I left a question mark next to C. And because I ruled out all the other answers as not concerning, then I have to choose C. And C does concern me because they could become suicidal if their energy levels improve before their mood improves. And so I would need to investigate what's going on and how they're feeling. All right. I hope that was helpful to you. And that is it for today. Thank you for being a part of our family. And if you're still here watching, I'll just tell you one story. I got a water pick to clean my teeth because my dentist recommended it. And y'all, did you know that you could spray yourself in the eye with a water pick? I think I've sprayed myself in the eye like 3 times. I've sprayed it all over the bathroom. I don't know how to use this thing. It's like really goes really far. So pray for me that I'll figure out how to use this water pick on my teeth because apparently I need to use a water pick. Okay. All right. We love you. Thank you for being a part of our family. Good luck on all your standardized tests that you may be taking. See you later.